So good morning, everybody. My name is Jessie Whittish, and I am with Kentucky Youth Advocates. Thank you again to everyone who is joining us today, whether that's for the first time or for, I think this is our 16th Advocate Virtual Forum, if I've done the counting correctly. So thank you for those of you who have joined us 16 weeks in a row. We are recording today's podcast to share as a video later. And then we are also going to use at least a portion of it as a podcast that we will also release later this week. So just heads up that we're recording. And because of that, we're just asking that everybody stay muted. We will use the chat for catching questions and comments. So all of y'all on this forum are advocates for kids. Like, we know that. That's sort of like we can agree on that as you've joined. And today we have a little something for everyone. So whether you're like a data geek or like you feel like you have your finger on the pulse of policies for kids, or you work with families every day, or you just want a little lift because you want to hear from some young folks who are going to lead Kentucky into the next generation, and you want to feel like, oh, okay, Kentucky's going to be fine. Today is the forum for you. I think that probably captures everybody here. So we at Kentucky Youth Advocates, we repeatedly say that what gets measured gets changed, because data is such a powerful tool for policy change and practice change. But we also know that data by itself isn't enough. So today's forum, we are going to talk about the newly released kids count data. And the forum's going to have two parts. First, we're going to start with a data presentation from KYA's research director, Amy Swan. And then to give some life and some voice to that data, we are going to hear from a panel of young people from across Kentucky, and that panel is going to be moderated by Kalra. So if you have questions, comments, put them in via the chat. And if you have questions about the data presentation, Amy is actually going to answer those in the chat after her presentation. So as you have questions, just put them in there, and during that panel, she's going to address some of those in the chat itself. So with that, I am going to turn it over to Amy Swan, who is going to tell us a little bit more about Kids Count and the data that just came out.
Hi, thanks. And let me know if you have any trouble hearing me. I am going to try to pull up the slides. I don't know, Jessie, if I have co-hosting capability. Okay, there we go. Hopefully you are seeing.
Yes, we are.
Snapshot. Okay. Okay. So yes, as you may have heard, if you follow Youth Advocates, we recently co-released the National Kids Count Data Book with the Ailey Casey Foundation, and wanted to share a little bit about of that data with you all, but frankly, we are not going to read through all of this data. We want to leave, the vast majority of today's time to hear from the young people on the call. And so what Jessie will do is she will, in addition to sharing the recording of this with everybody afterwards, share the PDF of this Kentucky data profile, as well as the spreadsheet that I'm going to be sharing with you, and maybe some other materials as well. It sounds like people are interested. So the Annie Casey Foundation puts this national book out every year, and it shows how each state is doing. It allows us to compare states. And so as you see here at the top, we have an overall ranking of 37. There are 4 domains to the profile, just as we use 4 domains in our county data book, which will be released at the end of the year. And the rankings, I've always had a love-hate relationship with, because on the one hand, they're a real hook to get media coverage, and definitely get a lot of attention by the more competitive among us, Terry Brooks. But but what we know about rankings, right, is that when you've got 50 states, you're always going to have a state ranked 50th. And so the rankings in and of themselves really don't tell us enough. And so I just wanted to point out a couple of other features on this profile that I highly encourage child advocates to pay attention to as they use this to inform their child advocacy efforts. And so, unfortunately, we are ranked in the bottom 10 of states when it comes to economic well-being. But you'll see over here on the right-hand side that we are improving on all 4 of these measures. And it shows you, a baseline of 2010 compared to the latest available data, 2018. So you can see how much we have improved. But if you look over at the left-hand side, it also shows you that, even though we have gone from having more than 1 in every 4 kids in Kentucky in poverty to, almost 1 in every 4 kids living in poverty, that what that really means is that there's still more than 200,000 kids who are living in poverty. And so, I do encourage you to look at those counts that are on the far left-hand side of the profile under the indicator name. And it also allows you to see, how we're faring compared to the nation as a whole. And it is no surprise to most of you that for many, many years now, Kentucky has been doing worse than the nation as a whole. So this is the economic well-being portion. I'm just going to click through really quickly to give you a sense of some of the other things that are on here. So in education, we have a much better rank. We're not in the bottom half of states. You can see it's a little bit of a mixed bag. And I want to point out, another reason why it's so important to kind of take in all the information on the profile and not just rely on a rank or on whether it says we're doing better. I think I have a feeling probably none of us on the call today would take solace in the fact that there's still 71% of 8th graders in Kentucky that aren't proficient in math. So yes, we improved a little bit, but my goodness, that's just, I think that's really shocking when people see that. And the 4th grade reading proficiency right above that has kind of weeble-wobbled around the same level for a while and got a little bit worse this last time. And then, point out that it's not all doom and gloom. We do have one of the best on-time high school graduation rates in the country. We're actually ranked 3rd in the country now. So you can see that only 10% of high school students did not graduate on time in the latest available data, and there's not available baseline data, which is why it says NA on the far right. But again, using the data in context, let's think about the fact that we haven't done great on 4th grade reading or 8th grade math in a long time. And so we do have to ask ourselves, is that diploma, the marker of success that we want it to be? Our kids leaving, having learned everything that we think they need in order to be, successful after school. So that's education. And health. Health is another area where we have a real bright spot that I just want to point out because, again, a lot of the Kentucky data can be a little depressing. And so that is child health insurance. We as a state, not taking personal credit, have done an amazing job in making sure that kids have coverage. And that is largely through getting kids that are eligible for public coverage, like Medicaid and K-CHIP, enrolled. And so you see that now we only have 4% of all Kentucky children not having health coverage. And we've seen, right, that our our governor is already taking steps to help with that. I think that as we get more parents who are eligible for public coverage covered, that we will perhaps see this percentage drop even further for children, because research has shown that one of the best indicators of a child being covered is that their parents have coverage. So just wanted to point out one more thing in the health domain before we move on, and that's that the National Kids Count book has a brand new indicator this year, and it's there at the bottom, and it's children and teens ages 10 to 17 who are overweight or obese, and the data does not look good for Kentucky. I wanted to point out first that the baseline is not even 5 years. 5 years in the past. It's literally a year-to-year comparison because of when the data became available, but we're already trending in the wrong direction for this new indicator, with more than a third of all of our older youth being either overweight or obese. Moving right along, the last domain is family and community. And so again, we see that we're making moves in the right direction, but again, taking it in context, is it good enough that we still have one of the highest teen birth rates in the nation, for example? So I think we can use this profile, this book, to to see where policy and practice change efforts are paying off. To also see where kids are still, lagging behind, being left behind, and to, push ourselves, more importantly, push our policymakers, our elected officials to continue to do better by Kentucky's kids. And I'm going to wrap up with a slide that a colleague helped put together, and we pulled what Kentucky data looks like disaggregated by race and ethnicity for each of these 16 indicators that I've just shown you on the screen. And so this is not pretty, but this is the spreadsheet. And so you can see that for almost all 16 of these indicators, we have African-American children and Hispanic children in Kentucky faring worse than their non-Hispanic white peers. And that's, I highlighted those cells in red to just make that point pop out. And so we have been talking a lot, we've been talking for well over a decade about how child well-being differs by not only race, but also income and place, geography in Kentucky. And that's true nationwide. And we want to make sure that people understand that when looking at something like the National Kids Count book, or other research or report cards on children, that it's so important to take the time to seek out and look at how that data does differ by race, place, and income. Because, for example, the child poverty I talked about, how now we have almost 1 in every 4 children in poverty. Well, you see that it's 1 in 5 on that top row for non-Hispanic whites, but it's 42% for our Black children in Kentucky. 42% is more than twice 20%. That is a huge disparity. And so, we wanted to provide this data to you, and help it, make sure that you're using it, and provide it as a context to kind of set that stage, to set the brain space, especially for next week's Advocate Virtual Forum, which is going to focus on policy solutions that are needed in order to address these racial disparities. And I'm sure Jesse will talk more about that before we wrap up today. And again, I just really quick wanted to point out that it's not just race, and the racial disparities that you do see cannot always be explained by socioeconomic differences. So, you know, I think about, and I wish I had pulled it up, but I think about there's a really remarkable stat that looks at, you know, um, the differences in mortality, you know, mothers passing away, you know, during childbirth, um, or even just having low birth weight babies between Black and white mothers. And when you dig deeper into that, you see that even if a Black mother has a higher level of education than their white peers, they're still more likely to give birth to, you know, low weight or preterm and to die during childbirth. And there's some really interesting research that's come out of that. And it's saying, you know what? It's because even though they're making more money, they have a higher level of education, they're better employed, that they're still seeing those higher rates because of the stress that, you know, living in a society that has such persistent chronic racism, you know, what that stress has done to their health and how that's literally borne out. And so please, you know, feel free to contact us. You know, my job, I really do see my job as, you know, being a resource for fellow child advocates who are looking for, you know, what's available, relevant, timely, reliable data, you know, if they need to advocate for children. And so we've got my contact information up there. Please, you know, use us as a resource. We know that sometimes data disaggregated by race isn't easy to find, or disaggregated by some of these other characteristics, and so that's our job. And with that, I'm going to stop sharing, and I'll remain on the call and answer any questions about data that come into the chat box as they come in, but also if something strikes you afterwards, you've got my contact information and feel free to reach out.
Thanks, Amy. I appreciate it. Hi, everyone. I'm Kalra. I'll be moderating the next segment of this discussion. So as Jesse said, we at KYA believe what gets measured gets changed as an organization. That's what we strongly feel. And so we could throw data at you all day. But these data points really represent Kentuckians and individual lives. So to give some life to this data, we're going to hear from 3 young people from across Kentucky. If you have any questions for them during this time, feel free to put it in the chat and we'll have a KYA monitor those questions and hopefully get those answered for you. So let me go ahead and introduce the 3 amazing young people that we have. First, we have Shalora Neely. She's from Harlan, Kentucky. She graduated from Harlan County High School and will be attending the University of Pikeville. She's an all-star and is going to double major in nursing and biology. So we met Shalora through the Berea Partners of Education Promise Appalachia Leaders in Service. That's a mouthful, or we could just call them PALS program. And she's been actively involved in advocating for policies that benefit kids in her community. So next we have Tony Hernandez Correa. He's from Glasgow, Kentucky, and he just finished his freshman year at Center College, which I'm sure was very interesting during this pandemic. And he is majoring in politics and government. Tony is a member of Glasgow Barron County Boys and Girls Club for 4 years, which is where we met him, and is continuing his internship there in the summer as a Spanish tutor. So thank you and welcome. And lastly, but surely not least, Katelyn Price is from Louisville, and she's a senior at Central High School. She's interested in politics, and after speaking to her, I have no doubt she's going to run for president one day. But she first plans to study at U of L after graduating from high school, and Katelyn is a leader with the Peace Education Program, which helps young adults to build and sustain positive relationships. So now that you know who each of our three speakers are going to be, I am going to kick it over to Shalora. So you heard Amy talk about the various factors: poverty, employment, education, income. They all have an impact in the outcomes for kids and families. And in Eastern Kentucky, many kids and families live in poverty or have experienced poverty. So my question for you is, can you describe how you saw some of these inequities from either your personal perspective or your peers or your neighbors?
Sorry, I was stuck on mute. Okay, so I live in one of the highest poverty counties in the state of Kentucky, and I'm actually not from here, so being an outsider helps me see it just a little bit more. That our children really struggle. They are looked down on. They never really have a fair chance. If we go out of the county, even, people look at us and they're like, "Oh wow, can you talk? You have clothes on? You got shoes?" They're never given the opportunity to really shine because they're just considered poverty kid from Eastern Kentucky with nothing. And the pandemic has actually hurt us to an extreme level because the children don't have the opportunities here that other kids have anyway. And we want people to be healthy at home, right? That's the goal, but we have nothing to give them to be healthy. Our parks have been closed, our libraries are closed, our streets are closed. You're not allowed to walk on them to tracks or anything. So they have no way to be healthy at home or to even read or anything like that. A group of teens that I'm working with in my community are actually working on creating activity packs so that the children will have something to do. We're going to put some chalk or some bubbles or a book in it and put it in our blessing boxes around our community, just so that the children will have something they can do at home to be healthy at home, because the parents can't afford it. We went through a thing with the mines last year, and I'm sure most of you have probably heard about it because it reached national news. And when the pandemic came around, they laid the miners off yet again. So most of them are even ineligible to get unemployment. So they have nothing. And where we're low poverty, we do get the little food card things for free food, but it only goes so far. So I just feel like we don't have a lot of opportunity to be who we need to be, or to shine, or to show people that we are capable of things, because even if you do try, you're shot down. I know personally, even going to Pikeville, people look at me and they're like, "Oh wow, you're never going to make it there. You're from Eastern Kentucky." And even though it's Eastern Kentucky there too, it's considered different because, they're Pikeville. They're big, and we're not. So it's hard to be a teen in Eastern Kentucky and have goals and dreams for your life because you're just shot down. And I want to give that opportunity to people. So that's my life goal.
Well, I appreciate that. And I appreciate you sharing your personal story and your thoughts. So I'm now going to ask Tony, you and your family are immigrants, and what you experienced as a young person, and ask you how that played out when you're thinking about those disparities that we saw in the data that Amy mentioned.
Well, good morning. Just a little background, I guess. I moved to the United States 5 years ago, February 1st of 2015. Ever since, I've been in the state of Kentucky, Glasgow to be specific. And yeah, as I was looking at the data, specifically the disparities, racial disparities and inequities, during the pandemic, as I mentioned previously yesterday while in the conversation, since my internship is focusing on second language learning, specifically Spanish, the availability that the Hispanic Latino community here in Barron County has to economic and health resources are very limited. Just because of a lack of awareness of those resources being available and of the misinformation around them. Something as simple as, for instance, the EBT card that was sent to parents during the pandemic to make up for school lunches. A lot of the Hispanic Latino community in Berrien County were unaware that those were available to them, could have been because they did not know how to apply if they had to apply, or because of a mixed immigration status among the parents, even though the resource was for the child, and if the child was a U.S. citizen, they were still hesitant of putting themselves out there in case they were undocumented or had another immigration status rather than being a U.S. citizen. And those disparities that I've seen ever since I moved to the U.S. have placed a lot of barriers, almost as Shalora explained, a lot of barriers for the young Hispanic Latinos here in Berrien County specifically to reach out for just basically reach out for any type of resource, just because of a lack of awareness, misinformation, and or not thinking that they're enough just because of I was in that position too, the not knowing English enough or lacking competency in English. That's why I'm currently being a Spanish tutor at the Boys and Girls Club, just because I think that as much as it is important to focus on a non-English speaker learning to learn English, it is also important that a monolingual English speaker should immerse themselves into another language, because it foments language learning, and in such a diverse country like the United States, it creates better communication among people. And just knowing that there's people out there that can understand your language, and that just opens doors to puts down barriers such as economic and health barriers, in my opinion. So yeah.
Thank you for sharing, Tony. I'm gonna turn it over to Katelyn in a second, but I just wanted to go back to thinking about pre-COVID, and then we could come back to COVID, and
okay.
Just talking about how those inequities have probably shined a greater light in the issues facing youth in our communities, and us also just thinking statewide what that impact has done. So Katelyn, as a woman of color, just thinking about your community and how you've kind of grew up in Louisville, I would be interested to see the impacts of race in your life and how that impacted the inequities that many youth of color face.
All right. Hi, my name is Katelyn Price, and I am from Louisville, Kentucky. I go to Central High School. And being a woman of color has always been difficult and will always be difficult. I've always felt like I have to work 10 times harder as my counterparts in my life. And it's just always really been a struggle in comparison to what other students may be facing, other students who aren't of color. And that's kind of just all around our community, all around the African American community, Hispanic community. It's just these different communities of color. You have to work harder and you have to do more. You have to take more steps. You have to put yourself there even more than what my counterpart would have to. And that's going to be something that's continuous. And looking at my friends and people who don't have situations, who are, as I see my situation as amazing, I'm so happy that I'm in the skin that people who support me, like, who ensure that I'm going to be successful. But there are families who don't have that, and that's very apparent. I mean, especially in this community where you don't have as many advantages as other people. There are people who are, like, looking at the data, I've seen so many things that related to my friends. And even to myself, when I looked at children who are obese or children who are African American, women, there's just so many different struggles and battles that you face. And it it affects us in many different ways. And I feel like that's kind of statewide. It's just not in just Louisville. It kind of goes all out around Kentucky, because when I meet others from different states, they're kind of like, you're from Kentucky? That's weird. You know, what do they have in Kentucky? We always see us as just, you have KFC, that's great, you know. But we have more than that. We have more to offer. And I kind of want to put us more onto the map, I feel like. I want to put us out as just this amazing community, because we have so many amazing people who come from Louisville and who come from different places in Kentucky who we just kind of overshadow because we have KFC. You know, that's great. And I just kind of don't want us to get stuck behind those kind of like misjudgments and things like that. And a lot of African Americans, I've noticed, we kind of tend to not want to do as much as we can because we don't feel like we're going to get anywhere. We don't really see ourselves going anywhere just because we put ourselves out there. And that kind of just, it ruins a lot of dreams and your imagination. At a young age, you just start to feel like, actually, once you get to middle school, everything kind of is a burden. You have these financial burdens, emotional burdens. I mean, emotional, Black people go through more things than I've ever seen. It's insane, because you really, sometimes your families, they don't really understand that it's generational trauma, where most African American parents have been told, you're okay. I mean, I'm doing this and that for you, so you're fine. And sometimes it's not materialistic. It's your mental and how you're feeling. And just because it's been passed on and over again, as far as we can remember. So we just push it away. So being an African American is detrimental to your health. Every single day you go out and you have to make sure, as a Black woman, I have to make sure I don't get too angry, because if I get too angry, you get that angry Black woman stigma. Or I'm not too loud, or I'm not too crazy, I'm not too loud, I'm not too anything. I have to worry about that every single day. I'm not being too much of anything. I'm not too much of Black, or I'm not too much of white, because if you're too much of white, the Black community kind of disowns you. So you just have to look at all these different things. So when you walk out the door in the morning, you're constantly attacked, and that's just being an African American. And then being a woman along with that is just, it's insane. You're growing up and you're getting all these stigmas, you're getting all these things, and the data just kind of breaks it down, and it represents all these things that are happening to you, all these things that you're going through as an African American. So in our community, we just need to learn how to unify ourselves more. You know, we need to learn how to be okay with these stigmas, you know, look the stigma in the eye and just be able to say, that's okay, I'm fine with being that, you know, I'm fine with being a Black woman, I'm fine with being loud, because I'm getting my point across to you. Maybe you didn't understand me if I was quiet. Maybe I had to just elevate myself just a little bit more so that you could understand what I'm going through. So I just really, that's pretty much how it is in the Black community, and just any community. Being an African American, all of that together, it's just kind of, you're constantly going through those struggles, and the data represents that. As a child, when you're first born, I mean, Black women, when they go into hospitals, there are pregnant Black women, okay? We get our medical things that we need to be treated for are kind of downplayed by doctors. We're never really safe. So I don't feel safe when I go to a hospital, or when I get pulled over on the side of a road. I don't feel safe. I'm not meant to be safe. And that's why I want the community, the community in Kentucky, put ourselves in these positions of power so that we can feel safe. Because you don't. I mean, it's really sad that you don't feel safe in these communities, but you don't. And it's really hard to not feel safe when I go to a hospital and I tell them that this is wrong with me, and they don't take me seriously because I'm African American. And I don't want to be seen as exaggerating, or you're going overboard. So just those statistics you have to look at, and it's deeper than the numbers and what the dates, you know, it's really deep, and it goes down. It resonates within me when we talk about that kind of stuff, because when I look at these numbers, I'm like, wow, you know, this is what it is. It proves, it shows you. It's amazing to me. But yeah, that's what I think personally.
Well, thank you. I appreciate each of your personal stories and your personal touches to this. It's very powerful to hear each of you speak and share what the data represents in your experiences. So if I'm going to ask each of you this question. If Kentucky policymakers really had a magic wand, what would you like to see changed? Tony, do you want to start off? And then I'll ask the rest of you all.
Well, now that I'm on the spotlight, well, magic wand, interesting. In my opinion, just since I've been focusing again on second language learning and the effects that it has within the Hispanic Latino community and the resources that are available to them and are not available to them due to the lack of English skills and or lack of, because my thing is, there, as I mentioned previously, something as simple as having forms and documents in the language of that person at the at the health department, at a school, anywhere, basically anywhere where anywhere, just having those documents in the native language of these individuals can make their life so much easier. Because like I served as a translator for my family since I moved to the U.S. 5 years ago, and ever since I've been their personal translator, basically. Both of my parents, my dad speaks somewhat has a decent grasp on English, but my mom doesn't speak it at all. So they're dependent on me to go to the bank, pay the bills, and translate this and translate that. I had to apply for my siblings, apply for Medicaid for my siblings when I was 15, 14, and have to translate all of that paperwork because they weren't available in Spanish. And just because of the lack of availability, a lot of these resources are out of reach for the Hispanic Latino community and for any other community that does not speak English. And so for me, something that I just think would make these resources available would be a policy change, as making it a requirement for certain documents at government offices, again, health department, schools, and basically anywhere where you are to encounter someone, or you may encounter someone that does not speak English, have these documents and have these forms in their native language in order for them to have these resources available to them. Because again, these something as simple as Medicaid that a English speaker can apply for, and not saying that it's easier for them, but the fact that they can understand the documents or the forms, or have, like, they are a native English speaker, makes it so much easier for them to apply for it and have that resource available. When on the other hand, like, my parents could not were not aware of how to apply for it, and were turned down multiple times until basically until a 14-year-old myself had to go through that paperwork. And so, in my opinion, having language accessibility to documents in the native language of any person makes it so much easier for these resources to be distributed in an appropriate manner.
Thank you. I think you just hit a critical point that we all kind of have heard, just knowing that there are barriers for families to have access to health insurance. And one of those critical steps and solutions is having language access, which is very important. So that way we get people covered and they have access to the services that they need. So thank you. So Katelyn, do you want to go next and share if you had a magic wand, or if policymakers had a magic wand, what would you like to see changed?
All right. So I would definitely like to see more unification. I feel like we're not unified as we should be. And that's exactly why I want to go into a position of power, like a presidency. And that's why I want to show people who are younger than me and the next generations that we can be in these positions of power. because we need people with experiences. We need people who are willing to travel and experience these different cultures and these different everything. We don't understand each other. We're so busy, divided, and just going so hard against each other that we're not even taking a chance to get to know each other. And that's a problem. That's an issue with everything, that as far as like public relations and helping each other, we don't do that. We're so busy just trying to keep our defense up. We have a defense up against each other, and it doesn't matter what community you are in. I just feel like we all just need to become more unified. We need to be together, especially with everything going on with the protests about race. We are all equals, and we should see each other as so. We should welcome each other with open arms, and we should understand each other's differences and try our best to help others cope with their differences. And I just really feel like we're missing that important aspects of life. You're only on this earth for so long, and to take that, just this time, and waste it on hating someone or not liking someone because they're different, or discriminating against someone, or just these simple things, missing out on experiences, because experiences are the building blocks of life. And I feel like we need that. We need to become more unified. So if I had a magic wand and I could help change a policy, I would just ask someone, what could I do to make you want to be around these people, want to love these people? Because you should open your arms as soon as you meet someone and just welcome them with open arms. I definitely agree with what Tony said. We need these barriers that we're putting on people. That should be something that we should already have. It should have been available to us. We should have access to that so long ago. I mean, there's no reason for us to not have these documents, these important documents that you need to live, translated for us already. And that's not fair. I mean, and that's just kind of been something that we've seen for years and years and years. And the fact that no one has changed it so far is insane. And that's why our youth needs to take the chance and step up. This is our time to show the next generation what needs to happen from just a culture point of view. It's not, we all should be together, and there's absolutely no reason for us not to be. And that's just what I would do. I'll just make sure that we're all unified as one, because that's the most important thing. You're only on the earth for so long. And especially with all this COVID going on, I mean, this should be our chance to just cherish each other and love each other and show each other how much we mean to each other. That's very important to me, and that's all I want to see in the future. I want to see us unified and all together, standing together as one, understanding each other, and comprehending our struggles. So that's what I agree with.
Thank you, Katelyn. I love your positive attitude and your thoughtfulness of creating culture change as important as policy change. So, Shalora, I'm going to ask that same question. If policymakers had a magic wand, what would you like to see changed?
I would love to see opportunities given to everyone, equal opportunities. Kids in my community don't even have internet access. They don't have access to libraries or anything to help them. I want them to have the same opportunity. If they lived in a bigger community, they could go to the library. They could get help. They could have fun with friends in a safe place. We don't even have a safe place for you to have fun with friends. Our parks are filled with needles and drugs, and it's not a safe environment for kids to grow up in. It's not something nobody wants their kid to grow up in a place like that, but most families are stuck here because financially they have nothing to help them get anywhere else. And in Harlan, the only jobs actually even here are like, you can be a nurse or you can be in the coal mines. And with the mines always like opening and shutting and opening and shutting, our poverty levels are extremely high. And I don't feel like that's accurately represented all the time, because it fluctuates. 1 month everybody could have a job, and then next week everybody's out of a job again. And the families that do that, they don't think to save money for that, because that's their job. Why would they think that wasn't a steady thing until recently? And then even with like the census, like we want everybody to fill out the census, right? But most of the kids don't have access to fill out the census. Like our library is shut, and shut down for the COVID stuff. And we don't have internet access here. Like, I'm one of the only kids in my county that has internet access. And that was even a problem with finishing schoolwork. Like, a lot of them failed classes just because they couldn't do it. So I actually have concerns about the next year for them. Like, what is that going to look like when we're buying them Chromebooks, but they don't have internet. So unless there's a way to, like, give them internet, they're still going to fail. We set these kids up to fail. We don't give them the opportunities that they need to succeed in life.
You bring up a critical point in the sense of we live in an age that we have modern technology. I mean, we're talking through Zoom, but just thinking about the lack of internet access in all the communities in the state, you know, that's an important need that we all have, especially this pandemic kind of has highlighted that. So thank you. I appreciate that, that personal story that you're sharing. So I have one last question, and it's more about highlighting the work that it has been happening in your community. I think we know that there's great pockets of work happening, especially during this COVID period. So I just, knowing that we have a lot of statewide partners on this call, I just wanted to ask you, what have you seen in your communities that has truly helped families during this trying time? I'm gonna just open it up for each of you all. I don't have a magic order, but whoever wants to jump, feel free to respond.
I'll respond. So I have a program in my school that I created called MEME, which is Mental Emotional Mindful Encouragement. And it's for students who suffer from depression, ranging from depression to just any other mental illness. And it's ways to cope with them or just to help them. And I've noticed that during this pandemic, we've had a lot of students, especially like our juniors and seniors, and even our freshmen and sophomores too, who have just had this detrimental drop in being mentally healthy. So what I've done is I created baskets, sleeping balls, crossword puzzle, and then I went house to house and delivered them to each of my students who are in my program and gave them a certificate of completion, because I was a junior this year, so I missed out on my ring ceremony. I missed out on being acknowledged for all of the great work that I've done this year and all the things that I've committed to and kind of pushed myself through. And that even had me in a sad place, you know, in a very soft spot where I felt very vulnerable. And that happened to a lot of seniors and juniors with ring ceremonies and graduations, proms. We kind of all missed out on those just amazing milestones in life. So I went and delivered those things, and I just seen the elevation of a student's happiness with each student, the smiles, and I just wanted to see a friend, you know? And I felt like that was really important to me, because seeing someone right now could be the difference between living tomorrow and dying tonight, you know? That was it helped a lot. And I feel like that's what we need right now. It kind of goes back to my unification point. We just need to come together, and we need to acknowledge that during these tough times, this is the time we need each other most. And especially in communities where we lack resources, or we lack the things that we need, it's good to have someone who's just ready to reach out to you and ready to come to you if they need help. So that's what I've done. And I just feel like that's a really good, if you need like something to do, I recommend it. It's amazing. The smiles and just the happy faces, just seeing someone can just elevate you in a different way. And it just made me feel amazing.
I love your thoughtfulness, Katelyn. Tony or Shalora?
Okay, I'll go. So, in my community, one of the things that I noticed a couple years ago at a CAD event with KYA was actually that we don't have good dental hygiene. And it's just because we don't have access to a dentist. We have one dentist, and the dentist doesn't take new patients. And it's in the center of town, and people don't have access to a vehicle, can't go to the dentist. So my friend and I actually started a Healthy Smiles dental campaign, and we go around to the elementary schools and give the children like little kits of like toothpaste or toothbrushes and floss, and teaching them the importance of having a healthy smile. Because I feel like by doing that, we're giving them just a little bit of opportunity to succeed in the future. Everybody knows if you look at somebody and all their teeth have rotted out, you think, oh, well, we don't want to give them a job because they're probably on drugs or something. So we stress the importance of you need to take care of your teeth so that you can succeed. We want you to have the best opportunity. And it really hit home for me when the first class we went to, there was this 5-year-old little boy, and he was like, I've got 7 cavities and I don't have to brush my teeth because my dad doesn't brush his teeth. He'd already lost 3 of his teeth to like dental decay and stuff. And that was just not okay, because this kid's going down a path that he won't have the chance that everybody else has just because he don't have teeth. And nobody ever taught him the importance of taking care of your teeth and your smile and making sure you present yourself well. That gives you opportunity. That sets you up to succeed in the future. And that's what we're trying to give back to these kids.
Terry, Dr. Rogers, Jennifer Hash, I did not tell her to say that. I just wanted to say that was all Shalora. That was not me. But yes, oral health is just as important to overall health and to a child's well-being. So thank you for that message and that plug. Tony, do you want to close us off?
I guess so. So as of lately, I'll just say this. I'm a Bonner Scholar at Center. So as a Bonner Scholar, I'm required to do community service and volunteer work at service sites. Since, again, when I'm not in politics, I'm fully invested in this second language learning and bilingual education and resource outreach to the Hispanic Latino community. With my previous service site back in Danville with Centro Latino, I don't know if some of y'all are familiar with it. It's a community outreach program for Hispanic Latino individuals in Boyle County and surrounding counties. And we offer mainly healthcare, like information, legal information, and immigration resources, such as contact to lawyers and stuff. And since we started, since the census back before quarantine happened, we attempted, and we're still working on it. Centro Latino and myself and a few other community members back in Danville are trying to reach to the Hispanic Latino community so everyone can count in the census, and have the availability that there's no inherent risk to filling out the census, since we want everyone to count. And back here in Glasgow, closely working with the Boys and Girls Club to have like plans to create a community outreach program for the Hispanic Latino community here in Barron County, and make resources available that the Boys and Girls Club offers to those individuals in the community. So that's what I've been doing on both sides, back in Danville and here. So yeah.
Well, thank you, all 3 of you. You've shared some great examples of just statewide or just local efforts that can be scaled up on a statewide level. You give me hope and inspiration to the work that we do every day. So thank you, and I appreciate it. And I am going to turn it over to Courtney to close us out.
All right, thanks, Mahek. So first, thank you, Amy, for sharing the data with us and how it varies based on race, place, and income. But a huge, huge thank you to Katelyn and Shalora and Tony for being vulnerable with all of us, for being brave, for reminding us of the lived experiences of the people who actually make up that data. And probably more than that, what you all shared is really powerful, right? Like your experiences, voices, your intellect are so, so powerful. So please keep speaking up, advocating, and being leaders. You all are amazing. Next week, we are going to be continuing this conversation a bit, but we'll be focusing more on race and on particular policies, practices, and/or systems changes that Kentucky must make to advance racial equity. So we have several partners who are going to be joining us to talk through what that could look like in healthcare systems, the justice system, education, and a whole lot more. So we will send out the link to next week's forum. I think some of you have already RSVP'd, and then we'll also send out some information about all of the data that we shared with you all today. So we hope to see you all again next week, and have a great day.
Thanks, everybody. Bye.